It's not clear how long Jackson County will be on the coronavirus watch list, and recent CDC changes call into question who should be getting tested. Joining us now to answer some of those questions surrounding the virus, again, Dr. Jim Shames, Jackson County Public Health. We appreciate your time as always.
Thank you for having me here.
So the state still has us on the watch list. Since the last time we spoke, have you been able to access any more resources that help you do your job?
Well, we have had help with case investigation from the state, some very experienced people who work with our staff, and I think we have more of those folks coming on. Nothing else has been needed at this point.
So when you look at the number of cases staying pretty consistent over 15 a day for the most part, is that an indication that, again, we just have more people in the area being exposed, or are there other things that are increasing our numbers?
No, I think it's to be expected that when you have a certain volume of disease in your community, that it just spreads exponentially. You get a lot of people who are spreading the disease to a lot more people. And that's kind of the phase we're in. We're hoping that, we can sort of snuff out these scattered episodes of outbreak and family spread and workplace spread. I think we're doing a really good job of identifying those as quickly as we can, but we'll see how the trend goes.
Do you see any indication that you are getting ahead of it right now? Certainly the numbers are staying fairly consistent.
Yeah, they're pretty high. I mean, we have plateaued, and that's good news, I suppose, although we really don't know. We plateaued before, and then the numbers have gone up. So yeah, it's not increasing every day apparently, but the numbers every day are way higher than we would like.
Any indication where the folks are getting exposed? You said there was some community spread, some familial spread. Are we finding out what the source of all this is?
I think the pattern has remained the same. People let their guard down when they feel like they're in a comfortable environment, whether it's a break room at work, it's carpooling with people they know, bringing friends and relatives into their house, into their safe space, and they don't do the things that they would do with strangers, perhaps, which is cover their face, keep their distance, wash their hands. And I would encourage people to be creative. Try and do the things you love to do with other people and do them out of doors, do them physically spaced. Get used to wearing a facial covering and looking at people's eyes for their expression, whatever it takes. But those basics haven't changed. And the stories that we see in terms of outbreak spread is that, and it's also really, it's people who don't have the same ability as others. So some of us have plenty of room in our house and we can create physical distancing. We don't have to carpool. We can drive our own private cars. We can work from home, whatever it is. Other people have a lot of people in their home because they can't afford to have a bigger house. They have to carpool because they can't afford to have their own vehicle. They have to work in an environment where they're working right next to other people. And those things all add up, put them at risk. And we're certainly seeing lots of, social discrepancies that put some people at greater risk than others.